Okay. It is April 19th, 2020. I am here with Gary Robbins. Gary Robbins, thank you very much for letting me interview you, sir. First off, I guess one of my first questions is where do you reside?
I live in Collinsville, Oklahoma.
Awesome. And what do you do? What's your occupation?
I'm a pharmacist.
Pharmacist. Okay, cool. And I guess since this whole pandemic has started, would how has the pandemic affected your occupation?
I think we're still fairly the same since I'm more of a retail pharmacist, so it it has shifted. Just kind of when the work actually happens. With right now in Oklahoma, we're kind of in a not necessarily a complete lockdown, shelter in place, but like non-essential businesses are shut down. So it has reduced, kind of when the traffic comes in, but it kind of comes in more compressed. So, but outside of that, it hasn't changed it a lot yet.
Oh, okay, cool. And I guess since you are a pharmacist, and I guess we're in the middle of this pandemic, would you consider yourself safe during at your occupation?
I think so. I feel fairly safe. We're not necessarily kind of what you call that frontline treating people. Since we're more retail, I think people who are, I mean, not that we couldn't be exposed to it, but we're probably a little less likely to. I think we're still taking care of people who are in more maintenance medication type, blood pressure, cholesterol type issues versus treating more people for that would be exposed to the virus.
Okay. And I guess at the location that you work at, sir, are there like any precautions that you all are taking?
Yeah, I mean, so right now we're following, trying to follow all the CDC guidelines. So hourly cleanings on all surfaces, trying to deep clean at the end of the day every day. We are all wearing masks. So, all employees within the store are wearing masks at a time. We have reduced hours, so that way we do have more time for cleaning. Then also, just like a lot of locations, putting out the guidelines on the floors for social distancing and just trying to keep people aware of that.
Okay. And like for yourself, like what are some of the precautions that you're taking?
I think I try to do the things that I've always done, but just be more vigilant of them. Obviously, every time you touch a surface, you have to be aware that what you are potentially touching. So just increasing that hand washing or any type of hand sanitation. Just trying to avoid any kind of hand to face touching just as much as possible. Also, just wearing masks personally, so that way we aren't potentially spreading that if we do have it. The symptoms take a little while before you actually know that you have it. So we're just trying to take all those precautions too.
Okay. And I guess like since you mentioned like you all are wearing masks there at your location, has it been hard to obtain like any of that medical equipment like the masks and gloves?
Masks have been a little bit strange. We actually had a technician who made reusable masks for everybody in the pharmacy. The gloves we were pretty well okay with, just because we had a good supply of those. Yeah, just because in our location we do a lot of vaccinations, so we have to wear gloves with each vaccination. So as far as inside the pharmacy, we were good on gloves and such. Masks again were a little bit hard to obtain, but that has gotten or has improved. I guess the other would be like the Germex hand sanitizer has finally started getting back into a normal flow for us.
Okay. And I guess like personal wise, like how has the pandemic affected you?
Probably a little bit with I have 4 children, so they've all been out of school. School's been closed, so just trying to make sure that we continue their education is probably the biggest thing that we kind of struggle with. The school system's done a good job, trying to roll out a way to move forward. Just kind of still the unknown of how long that will last. Will school be back actually in session come this fall? And there's still lots of discussions there. I mean, a lot of things can change over time, and it's a very fluid situation. But that's probably the biggest thing for me. It was just managing 4 kids and their education.
Okay, nice. And I guess have you been able to like go out to the stores and like I guess get like essential items?
Yeah, I mean, like I said, most anything I can get at work that I need. The grocery stores are still open and fairly well stocked, and haven't had any major issues with those. I mean, there's certain items at given times that might be out, but currently there hasn't been a big issue getting anything that we might need.
Okay, and I guess whenever you do go, like whenever you do shop there at the store that you work at, or even at a different store, like what are some of the observations that you have made?
Well, originally, probably like 4 weeks ago, I mean, it was just everything, just kind of, everybody was kind of almost in that order mentality of just buying everything. I guess just a little bit of the panic buying and such, and so I think it caught a lot of the vendors unaware. They weren't ready for it. So, it did seem like shelves were empty for a while, but that's all started to improve. And I think as people have gotten a little bit more comfortable with the situation, they're not as likely to kind of buy that panic or go into that panic buying and such. And so it's kind of leveled back out.
Okay, awesome. And I guess like, oh, what am I saying? I guess has there been any cases of like of people being affected from the coronavirus in the town that you live in?
In the town I live in, I don't know of any direct ones in in the area around us. I mean, I actually do have a cousin who is in the hospital, who had a more serious case and actually was put on a ventilator. She's still in the hospital, but she's off the vent, so she is improving. But outside of her, I don't have any other people that directly have tested positive. I think part of that's probably because just in Oklahoma, the testing supplies are pretty low, just because we haven't been in that kind of what they call the hot zones, or we're not having it as hard as some of the other areas are. So I think they've kind of redirected some of those supplies to those harder hit areas.
Oh, okay, nice. And I just got a question. I guess for like your mental health, because we hear a lot of people doing a lot of like self care, a lot of mental health awareness. Like, what are you doing to I guess to combat boredom and being stir crazy?
Right. Well, with me, like, since I am still, since we are considered essential, for the majority of my day-to-day routines haven't changed significantly. I still interact with coworkers and children and my children. But just always trying to just make sure they're always engaged in conversation. Talk to them on a daily basis. Or talk to my children on a daily basis. Always obviously have my coworkers on a daily basis. I think it's just trying to keep things, quote unquote, as normal as possible. We haven't, again, like I said, we haven't been restricted quite as hard as some of the hotspot zones have been, but we're still trying to minimize it as much as possible. But just continue to try to work on what they call the new normal and and roll with it. So.
Okay, nice. And I guess uh, once the quarantines have been lifted and hopefully sooner than later this pandemic is over, like what's one thing that you wanna do after all this is over?
I would, I think probably like most people, just being able to get back out and enjoy nice meals at a restaurant, and sit down with friends and family, and just be able to have more people around you and enjoy time with friends. So.
Okay, nice. And I guess my last question, it's just like an opinionated question, like it's just solely your opinion. Like what do you think of the response time, that it took for the United States to act on the situation?
I mean, I think that's one of those. It's kind of hard to judge. I think we probably, a little behind the curve, but I think some of that was there was also misinformation being presented to being presented by various organizations about the transmissibility of the virus itself. So I think it did catch some places a little unaware, but I think every state has responded a little bit differently, and I think when you look at kind of the differences between California and New York, I think California probably responded to it in a better way. They haven't seemed to have been hit as hard, and you would have, for me, I would have expected them to kind of be to bear the brunt of it, just with it having originated in China, and California kind of probably being one of the major first stops for any people coming from California or from China. I'm sorry, and so they haven't seemed to have been affected quite as much. I mean, they're still significant, but when you look at the size of the population of California, I would have expected it to be an equivalent to New York. So I think they did a really good job there. And just in general, I think probably the United States in general is probably not prepared for a pandemic, and weren't prepared. And I think hopefully we look at it and we move forward, because coronavirus isn't the last one we'll see. I mean, we have flu every year, and this last year flu was pretty significant, and it seems like it has gotten more aggressive every year that I've been in pharmacy. So I think that's hopefully we roll what we've seen this year into better general protection for everybody.
Okay, awesome, cool. Well, thank you, sir, for letting me interview you. And if there's any like follow-up questions that I may have, like when when the whole pandemic is over, could I be able to contact you again?
Sure,
Okay,
that would be fine.
awesome, cool.